This was a study looking at natural conception and prospective time to pregnancy in women that were between 30 and 44 years of age. So these women were trying to conceive naturally. None of them had any history of infertility, and they were followed up for up to a year. And they were measuring urine samples and recording the time of intercourse and menstrual cycles and all of the things like that, including the supplements that they were taking. So they looked at a total of 1,036 women and analyzed a total of 4,775 cycles. What they found after adjusting for age, obesity, previous pregnancy, race, and vitamin D intake, that women taking omega-3 supplements had 1.8 times the probability of conceiving in a given menstrual cycle compared to women that were not taking omega-3 supplements. Interesting, huh?
Yeah, very interesting. That's a lot. That's a big difference.
That is a big difference. Mm-hmm. Hi, superhumans. I'm Dr. Mavis Garcia.
And I'm Dr. Wise.
We're two of the physician leaders at Markham Fertility Center, otherwise known as Our Baby, MFC.
As fertility specialists, we've witnessed firsthand the challenges, triumphs, and the myriad of emotions that come with trying to conceive. Whether you're just starting to think about having a baby, actively trying, or facing challenges along the way, My Fertility Podcast will be your go-to resource for honest conversations and a supportive community.
So grab a cup of coffee or tea and settle in, and let's demystify the world of fertility together. All right, here we are again with another episode.
Very, very exciting one. And this is a really good one. This is an interesting one.
Today we're talking about what should you take while trying to conceive. Everything you need to know about vitamins and other supplements on your journey to a pregnancy.
And this is a question that comes up like all the time, for sure, in terms of people wanting to know, because it makes sense. When you're planning a pregnancy, you want to do everything you can to start off in the best possible foot forward, you know?
Absolutely. And it's an area with a lot of misconception and misinformation. So we're really going to do a deep dive into the evidence, and we're going to talk about prenatal vitamins. We are going to talk about folic acid and the different types of folic acid or folate supplements. We're going to do a detailed discussion about the much debated NT-FHR mutation, as well as other vitamins such as vitamin D and omega-3, and explain the research behind it and why you should consider taking it.
And of course, we're also going to talk about coenzyme Q10 or CoQ10. What is it? Who should be on it? And how do you choose the right form of CoQ10? So let's start with the prenatal vitamin. I think everybody knows that if you're thinking about pregnancy, the prenatal vitamin is the place to start. But what's so special about a prenatal vitamin? How is it different from a regular multivitamin?
Well, they are different from regular multivitamins. Prenatal vitamins are specially formulated to cater to the increased needs of the pregnant women. The Society of Obstetricians and Gynecologists of Canada and the American College of Obstetricians and Gynecology recommends prenatal vitamins specifically because they contain higher levels of certain nutrients that are crucial during pregnancy, such as folic acid, iron, and calcium.
For example, when you go to, a drugstore, you pick up a regular women's multivitamin, may contain 400 micrograms of folic acid, but a specific prenatal vitamin may contain 1,000 micrograms of folic acid.
And speaking of folic acid, why does this matter?
Folic acid, it's a synthetic form of folate, which is a B vitamin, is absolutely vital in preventing neural tube defects in the developing fetus. And so neural tube defects are a family of birth defects of the brain and spine. And there's several different types. So you may have heard of things like spina bifida, cleft lip, cleft palate, anencephaly. And the SOGC and ACOG, which are the Canadian and American Obstetrician Gynecologist Societies, they both recommend that all women of childbearing age take a daily supplement containing anywhere from 400 to 1,000 micrograms of folic acid daily. And the really important one is the recommendation is that this should be started at least 3 months prior to conception, because it's so crucial during the first trimester of pregnancy, because that's when the neural tube develops. So really, the ideal situation is to get your levels up before the conception even occurs, so that that first trimester is going to be as healthy as possible.
Exactly. So 0.4 to 1 milligram of folic acid for any women of childbearing age, but there are some people that should take extra folic acid. For example, women who are at high risk of having a baby affected by neural tube defects, This would be if you had a prior pregnancy affected by a neural tube defect, if there is a family history of neural tube defects, if you have insulin-dependent diabetes or you have epilepsy that is being treated with medications such as valproic acid or carbamazepine. In any of these situations, you should be taking a higher dose of folic acid, anywhere between 4 milligrams and 5 milligrams daily. Folic acid should be taken alone. It's very important not to take 5 pills of a multivitamin that contains folic acid in order to get to the 5 milligrams of folic acid. So if you're in the high-risk category, you should take 1 prenatal vitamin and supplement with folic acid alone. Usually folic acid comes in about 1 to 2 milligram tablets. The choice of taking 5 folic acid daily is something that should really be discussed with your doctor. Just because we're going to talk today about the benefit of folic acid, it doesn't mean that everybody should rush and take as much folic acid as possible. It is important that if you're a high-risk person who needs extra folic acid, you discuss that dose with your doctor, and the high dose of folic acid of 5 milligrams should be done under medical supervision. Now, we want to spend quite a bit of time talking about the difference between folate and folic acid and talking about that mutation that we talked about. Now, this is a bit complicated, so stay tuned and listen in. All right, so there's 2 things. There's folate and there's folic acid. Folate is a generic term that is used to refer to natural folates in food, but also synthetic folates, which is something that is made in the lab and is what you find in supplements. Now, dietary folates, they are absorbed from the intestine, and through a sequence of chemical reactions, they are converted to something called L-methyl tetrahydrofolate or L5-methyl THF. This is the active form of folate in the body. The process of converting folate to plasma folate or L-methyl tetrahydrofolate is done by an enzyme produced by the NTHFR gene, and this is involved in the last step. Now, that is for dietary folate. Now, for folic acid, which is a synthetic form of folate, it is also converted in the intestine by the same enzyme to the same final product of L-methyl tetrahydrofolate in the plasma. And this is also the active form of folate in the body. So both the dietary folate and the synthetic folic acid are converted into the L-methyl tetrahydrofolate by the enzyme coded by the gene NTHFR. Now, the very important point to make is that where they both go through the same pathway, folic acid is the only form of folate that have been shown to reduce the risk of neural tube defects. And neural tube defects is a very serious birth defect that involves the brain and the spine. And only folic acid has been shown in big studies to reduce the risk.
So this MTHFR gene, which there's so much out there about it right now, like on social media, this gene produces the enzyme methylene tetrahydrofolate reductase, which converts 5,10-methylene tetrahydrofolate to the primary form of folate, 5-methyl tetrahydrofolate, that is used by the body. This gene touches many functions in our body. So in the genetic code for the MTHFR gene, there are 2 common variations. And these genetic variants are also known as polymorphisms because they're so common in the general population that they're not really considered mutations per se. In fact, about 30-40% of people will have one of these polymorphisms potentially.
So you might have heard out there in the virtual world, they claim that if you happen to be one of these 30 to 40% of individuals that have this genetic polymorphism, then you may not process folic acid properly, and therefore you should not take folic acid, but you should take methyl tetrafolate, which is the end product of the folic acid metabolism. The problem with this statement is that 5-methyl tetrafolate has not been studied in reducing the risk of birth defects and neural tube defects. What has been studied very well is folic acid in the dose of 0.4 to 1 milligram. It's very effective in reducing neural tube defects, even in people that have this polymorphism that we're talking about. And just to highlight this point, I want to emphasize just how strong the evidence is for folic acid supplementation. So let's talk about the results of the Medical Research Council vitamin study, which was pivotal in help guide this recommendation for folic acid supplementation. It was published in The Lancet, a very prestigious journal, in 1991. This was a randomized double-blind prevention trial. So a randomized double-blind trial is the highest level of evidence that exists in medicine. And it was conducted in 33 centers in 7 countries to determine whether supplementation with folic acid or a mixture of other vitamins around the time of conception can prevent neural tube defects in women that were actually at high risk for neural tube defects. So there was a total of 1,817 women at high risk of having a pregnancy with neural tube defects. That could be due to a previously affected pregnancy or other reasons. And they were allocated to different groups. Some of them had folic acid and some of the other groups only had vitamins without folic acid. What the study found was a 72% protective effect of folic acid in neural tube defects. So in other words, the risk of having a child with neural tube defect in women that were at high risk for neural tube defects and who had proper supplementation with folic acid was reduced by 72%. There was no demonstrable harm of the folic acid supplementation in the study, and therefore, folic acid supplementation prior to pregnancy can now be firmly recommended for all women, and specifically for women at high risk for having children affected by neural tube defects.
In fact, in 1998, the U.S. began mandatory fortification of wheat flour with folic acid, and many other countries, including Canada, followed suit. And what's really interesting is that in the U.S., food fortification has actually been linked to a 19% decrease in all neural tube defects, with an 11% decrease in anencephaly and a 23% reduction in spina bifida. That's wild.
I know. It had been estimated that 16 to 58% of neural tube defects can now be prevented by folic acid supplementation.
It's worth noting, though, that although consuming 400 micrograms of folic acid each day can prevent the majority of neural tube defects, some have other causes that are unrelated to folic acid intake, like chromosomal abnormalities or other medical conditions. So it's not a 100% perfect solution, and that's something worth keeping in mind.
I think it's important to know that pretty much every society around the world that studies women and pregnancy does recommend folic acid, non-methyl tetrafolate supplementation to prevent neural tube defects. That would be something like the American College of Obstetricians and Gynecology and the Society of Obstetricians and Gynecology of Canada. Many of these organizations as well recommend again testing for the NTHFR gene variant because there is no association between how one processes folic acid and this particular gene mutation. And again, the studies have shown that neural tube defects are prevented by proper folic acid supplementation, even if you have this genetic polymorphism. In summary, methylfolate has not been studied to prevent neural tube defects. Maybe we'll find out at some point in the future that it's equally effective to folic acid, but right now we do not have the evidence to make that statement. We know that folic acid alone, non-methyl tetrafolate, can prevent neural tube defects even in people who are high risk at the doses of 4 to 1 milligram or a higher dose for people with specific conditions. And it's important to know neural tube defects are a really big deal and not something that we want to be messing with when we know that there is something very effective with very minimal risk that can prevent this devastating condition.
That was really, really interesting, I have to say.
Yeah. When I started doing research for this, I went down the rabbit hole of the internet, and unfortunately, there's a lot of claims being made, and I feel passionate about it because, like I said, you have seen babies with anencephaly. I have seen them too, right? I know that folic acid isn't going to prevent every single one of them, but certainly it would break my heart to know that this condition can be prevented and it wasn't prevented because of misinformation.
Yeah, absolutely. So on the topic of prenatal vitamins, I think it's important to ask the other question. What else should you be looking for in a prenatal vitamin?
So something else that should be in your prenatal vitamins would be iron. Iron is important for the development of red blood cells in the growing fetus. Women who are pregnant require about 30 to 60 milligrams of elemental iron. You can also get iron from food sources such as beans, lentils, breakfast cereals, beef, and shrimp. I like shrimp.
It is tasty, yes. Another one that will be in a prenatal vitamin that's really important is iodine. Again, you can also get iodine from food sources like iodized table salt, dairy products, seafood, meat, some bread, eggs. But iodine is really important for the production of maternal and fetal thyroid hormones that regulates the development of the fetal brain and nervous system. And a woman's iodine requirements increase a lot during pregnancy so that the baby can get enough iodine. And so the American Thyroid Association recommends that women who are planning pregnancy, who are pregnant, or who are lactating should be taking a supplement that has at least 150 micrograms of iodine per day.
Another one that is not commonly talked about is choline. Choline is actually not present in many prenatal vitamins, so you need to take it from your diet or take an extra supplement. Choline is an essential nutrient found in plant and animal foods, and pregnant women need more choline to help the baby grow and develop. Higher choline levels might be protective against certain birth defects and increase memory test scores in children. Choline can be found in food sources such as chicken, beef, eggs, milk, soy products, and peanuts, and plant sources such as navy bean, Brussels sprouts, broccoli. The recommended amount of choline supplementation during pregnancy is about 200 to 300 milligrams of choline in a daily supplement.
Another really important nutrient to consider is omega-3 fatty acids, which are also called DHAs. And so in pregnancy, the recommended dose is 200 milligrams per day, and this supports brain and eye development in the fetus. Now, it's super important to note that typically you're not going to find DHA in most prenatal vitamins. So you really need to think about taking an extra supplement or getting enough in your diet. For food sources, flaxseed is an excellent source of omega-3s. You can either use ground flaxseed or flax oil. And again, it's great because it's vegan. And then fish is another really big one. There are some other sources, including broccoli, cantaloupe, kidney beans, cauliflower, walnuts, but the amount that they're going to contain is a lot lower. And so you may need to take a lot more of them on a daily basis. If you're trying to get enough omega-3s into your diet, then the recommendation is to eat at least 2 to 3 servings of a variety of different fish or shellfish per week before getting pregnant and while pregnant.
Another important macronutrient is calcium and vitamin D. The recommended daily amount of calcium for pregnancy is 1,000 to 1,300 milligrams. For vitamin D, the recommended amount is 600 international units a day. Good sources of calcium would be milk and all the dairy products, but you can also get calcium from broccoli, fortified foods such as cereals, almonds, and sesame seeds, and also sardines and dark green leafy vegetables. Vitamin D, you can get it from sunlight, as well as fortified milk and breakfast cereal, and some fatty fish such as salmon, sardines, and mackerel. I just heard that you love mackerel.
I love fish. I love sardines. I love anchovies. I love mackerel.
How do you like your mackerel?
Smoked. Like a nice hot smoked mackerel. Oh, so good.
Okay, I'm coming over to your house to have some mackerel. Saturday night. A typical prenatal vitamin contains 200 to 300 milligrams of calcium and 400 milligrams of vitamin D. Now, we discussed vitamin D and omega-3 in prenatal vitamins and nutritional recommendations in pregnancy. But of course, we're fertility specialists, so we want to talk about vitamin D and omega-3 recommendations in women who are trying to conceive or facing fertility issues. So stay tuned because the dosage and the evidence is a little bit different.
Mm-hmm. So back to vitamin D here. Vitamin D, often called sometimes the sunshine vitamin, is essential, as we know, for bone health, immune function, cell growth. And there's so many studies out there talking about the importance of vitamin D in general health. But when we're looking at fertility specifically, there's actually several studies that have investigated this relationship between what somebody's vitamin D levels are and fertility. Some studies, such as Oskan et al. And Rudick et al., have found that vitamin D levels are in fact associated with higher pregnancy rates. But there was another study that looked at implantation of euploid embryos specifically, and there was actually no correlation between vitamin D levels and implantation, meaning that the chance of a euploid embryo working was the same whether a woman had vitamin D deficiency or not. There is a lot of conflicting evidence out there, so there are no specific guidelines to a specific vitamin D level that is predictive of pregnancy. And there's no specific guidelines on measuring vitamin D levels to really guide therapy either. In fact, vitamin D testing is not covered under OHIP, and it's not covered by insurance in the US.
So even though there is no specific guidance of measuring vitamin D level for fertility, we do know that there is a widespread vitamin D deficiency in countries like Canada, where we don't get a lot of sun. So the recommended daily allowance of vitamin D in Canada is 2,000 international units a day for all individuals. And this is what I take every morning. But it's also very important for people who are trying to conceive.
So let's go back to omega-3 fatty acids again, specifically omega-3 and fertility. As we said, omega-3 fatty acids are this group of polyunsaturated fats. Oftentimes we call them DHAs as well. And as we know, they're super essential for the functioning of every cell in the body and have lots of widespread health benefits.
They have been associated with improved outcomes in terms of heart health, such as lowering cholesterol and blood pressure, and decreases the risk of heart disease. They also have anti-inflammatory properties, and they have even been studied in the context of improved mental health. I take my omega-3 every morning.
Well, we all know I like fish.
Smoked mackerel. Now, for women trying to conceive, omega-3 fatty acids are particularly important for their role in reproductive health. There was a very interesting study published in 2019 in Fertility and Sterility. This was a study looking at natural conception and prospective time to pregnancy in women that were between 30 and 44 years of age. So these women were trying to conceive naturally. None of them had any history of infertility, and they were followed up for up to a year. And they were measuring urine samples and recording the time of intercourse and menstrual cycles and all of the things like that, including the supplements that they were taking. So they looked at a total of 1,036 women and analyzed a total of 4,775 cycles. What they found after adjusting for age, obesity, previous pregnancy, race, and vitamin D intake, that women taking omega-3 supplements had 1.8 times the probability of conceiving in a given menstrual cycle compared to women that were not taking omega-3 supplements. Interesting, huh?
Yeah, very interesting. That's a lot. That's a big difference.
That is a big difference. Mm-hmm. So while there's no specific recommended daily intake for omega-3 in fertility, based on the studies like the one I mentioned above, a general guideline would be to include 2 to 3 servings of fatty fish per week or to take 1,500 milligrams of omega-3 a day.
So now on to, last but not least,
my favorite.
We have coenzyme Q10, otherwise known as CoQ10. Coenzyme Q10 is a naturally occurring substance in the body and again plays a crucial role in the process of energy production within cells. It's also known for its antioxidant properties, protecting cells from oxidative stress and damage. The interest in CoQ10 for fertility specifically primarily stems from its potential impact on egg quality and ovarian reserve. Research suggests that CoQ10 can improve egg quality by enhancing mitochondrial function. So if we all think back to our high school biology class, the mitochondria was the so-called powerhouse of the cell. So as women age, the energy production in their eggs diminishes, potentially affecting egg quality. And so CoQ10 supplementation has been shown to improve this energy production, thereby potentially enhancing egg quality.
There was a study published in the Journal of Reproductive Biomedicine Online in 2018 that investigated the effects of CoQ10 on ovarian response and egg quality in older women undergoing IVF. This study showed that CoQ10 supplementation improved ovarian response and increased the number and quality of retrieved eggs in this population.
There was another study published in the Journal of Assisted Reproduction Genetics, which explored how CoQ10 supplementation could counteract the age-related decline in egg quality and quantity. The findings in this study suggest that CoQ10 might actually positively affect egg quality by enhancing energy production in older eggs, which typically have reduced mitochondrial activity.
Now, unfortunately, no studies have shown the improvement in the ultimate outcome when it comes to fertility treatment, and that would be live birth rate. But of course, these studies would be very hard to do with a large data value and resources. And given the low risk of CoQ10 supplementation and the data that we currently have about the possible mechanism for improved egg quality in the age-related decline in egg quality that we all know and read about, we would definitely recommend CoQ10 supplementation to anyone trying to conceive after age 35. It is really important to stop taking CoQ10 after pregnancy, has been established, given that CoQ10 has not been studied in pregnancy.
So that was a very dense episode.
Yes.
But I think a lot of really, really great, valuable information.
Yes. And honestly, there was so many more studies that I could have cited.
Absolutely. And again, we can always do something in a future episode.
That's right. If you want to know more information about folic acid metabolism, folic acid supplementation, and the MTHFR mutation, I recommend that you follow Babies After 35 account on Instagram. This account is managed by Dr. Shannon Clark, double board certified professor of obstetrics and gynecology and maternal-fetal medicine. She is very evidence-based and is very good at dispelling myth about these issues. She also provides amazing, very easy to understand information about many other topics in pregnancy. I highly recommend her account.
Another fabulous Instagram account that we both follow is the account from Dr. Jen Gunter. She is a Canadian-born gynecologist who was practicing in the US. She's also a best-selling author of several books on gynecologic topics, including menopause and the menstrual cycle. Her Instagram account is at Dr. Jen Gunter. And we highly recommend also checking out her website with her blog, where she talks a lot about the MTHFR mutation as well. Her website is www.thevagenda.com. And that's a wrap for today, Superhumans.
If you're looking to connect, get social with us. Follow us on YouTube and Instagram at My Fertility Podcast or visit us online at myconfertility.com. And don't forget, follow, subscribe, and share your favorite episodes.
Thanks for listening to My Fertility Podcast and for being a vital part of our community. We know you've got this.
We're signing off until next Tuesday.
If you found this episode of My Fertility Podcast helpful, please take a moment to head over to the review section and leave us your thoughts. Your reviews and comments are incredibly valuable to us and help guide future episodes. We also welcome you to direct your questions to info@myfertilitypodcast.com.
My Fertility Podcast is produced by Rabbit Media Inc. in conjunction with Dr. Garcia and Dr. Weiss. Music from Mix Kit Raising Me Higher by Ajay Stelino. My Fertility Podcast is not intended to replace any type or variation thereof professional medical, health, or legal advice, nor should the content be taken as medical advice. Please contact your primary healthcare professional regarding any medical questions you may have. The information presented in this podcast is based on the knowledge and understanding of the host at the time of recording. Medical knowledge is constantly evolving, and new research may change the understanding of health-related topics. While we strive to provide accurate and up-to-date information, we do not guarantee the completeness, accuracy, or timeliness of the content. The views expressed in this podcast by guests are not those of the host or the management. This podcast is not intended to impose any type of discrimination. My Fertility Podcast and its management are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast.